there. It's thought that that may be so that we don't have our vision pulsing with each heartbeat. But the fovea is where we have our best reading, color, and center vision. And it's important that this structure stay normal and not have any fluid on it. The fovea actually is about the size of a letter E on a newspaper, so it's a very small but important piece of real estate in the back of the eye. And here's an actual picture of one of our employees in the office, and you can see that the macula is normal and the blood vessels look all very distinct. I see the blood vessels all come from the, pretty much all come from the optic nerve. This is a normal angiogram, and this is a different kind from the kind of angiogram that you might get in a hospital with iodine-based dye. This is a dye that's placed in the vein and then travels through the bloodstream and then lights up the blood vessels in the eye. It can be a useful tool in seeing where blood vessels are leaking or are damaged in diabetic retinopathy. Here is a picture of someone with mild to moderate, I would say more moderate, non-proliferative retinopathy or background diabetic retinopathy, and you can see the small little red spots are damaged little blood vessels. This person may have normal vision and not even know that they have this, but in this person's, this is a sign that this person's blood sugar has probably not been as good as they might think it is. Frequently the back of the eye looks like the blood sugar did 2 years ago, so even if you have great sugar control, you still may be paying the price for past bad sugar control. So when you see something like this and the sugar and the vision is good, this doesn't mean that they're fine. This means that there needs to be action to make sure that the diabetes, the diabetic retinopathy does not get worse, which means you need to lower the A1C. Here's an angiogram of a similar patient, and you see where the blood vessels are leaking, and the angiogram does a great job of showing where the blood vessels are abnormal. With more time, there's more leakage of the fluid or the contents of the blood. You can see the fat and the cholesterol from the blood leaking out in kind of a round area around or below the fovea. And this is where fluid is in the back of the eye. With special instrumentation that we use in the eye clinic, you can see, sometimes you can actually measure how thick the swelling is, and we can see in 3D frequently with our equipment, so we can see how much swelling there is. And here the fluid does extend into the center of the vision. This is an example of new blood vessels growing. This person has a bunch of new blood vessels growing out of their optic nerve. Frequently this causes problems when the patient's asleep and you start dreaming and the eye moves rapidly back and forth. These blood vessels then break and bleed and can fill the eye with blood. And this is a patient where that's happened. You see the blurry spot kind of just to the left of the center of the vision where the camera is taking the picture through the blood that has filled the, stained the jelly of the eye. You can see some blood settling off to the right, and you can see the remnants of the new blood vessels on the right-hand side of the optic nerve. This is an angiogram of the same person, and you see as early in the series of pictures, the dye lights up the optic nerve, and then you can see the dye, which comes from the blood, is leaking, and so you see that means there's leakage of blood through those new blood vessels, and that's further on. So this is a patient where the blood vessels are broken, and actually you can see a collection of blood that's layered out. It's pressed against the back of the eye because of the jelly that's in the eye has compressed it backwards, and you can see a layering. That layer forms because as human beings we spend most of our life upright, and that's why the meniscus or the flat line at the top is that way. Vision loss is almost completely preventable, and it's stunning to me that in a country with so many resources and educational opportunities to learn about diabetes, diabetes has remained the #1 cause of vision loss for working age people for so long. So in my experience, and I think the experience for a lot of other doctors, and now there's some good studies that show this, patients who know their A1C have lower A1Cs. And I think that's because they're able to, one, interact with the doctor on a higher level, and they're less likely to accept good or bad as an answer. They need to really know that exact number. If your hemoglobin A1C has been running 6.5 for a long time, which is a good, relatively good number, and jumps up to 8, the patient who knows that is going to be in a better position to tell the doctor or help the doctor find out why that went up. Because the patient's the best person to know what went on in the 3 months prior to the test that was different from before. So knowing the exact number and not whether it was just good or bad is a really big deal. I think also doctors, primary care doctors, are just human beings, and you know, if the patient shows them that they understand what a hemoglobin A1C is, I think they're more likely to pay attention and discuss the details of diabetic control with that patient. And it's important when your hemoglobin A1C is not at 6.5 or 6, that I think is the recommendation that some doctors are even pushing for now. The patient needs to ask the doctor what it's going to take to get that number below 6.5. And whatever the action point is, 6 or 6.5, whenever the hemoglobin A1C is not at that point, the patient and the doctor need to take action to get that to that goal. So how to lower your A1Cs? Show your doctor you care. Don't let your family do everything. It's amazing how many men I see let their wives answer all the questions. You need to constantly learn. You need to take a diabetic education class. In some states like Florida, it's the law. Diabetic education classes prevent doctor visits and bad complications from diabetes later on in life, and it's a great investment. If you haven't taken one in a while, even if you have one, it's a good idea to take a refresher class or meet with a dietitian, because it is amazing how much you forget in a few years. And there are changes that occur in the science of diabetic control, and so you need to stay abreast of those things. Joining the American Diabetic Association is a fantastic way to learn about diabetes. Their magazine, Diabetic Forecast, comes every month, and it's a great way to learn in small bite-sized chunks what is new in diabetes. It's amazing what you learn, how much sugar there is in ketchup, how much, what are the best things or what are not the best things to eat at your favorite fast food restaurant. So subscribing to Diabetic Forecast through the American Diabetes Association is one of my personally favorite ways to keep abreast of those kind of changes for patients. So where can you get more information? You can check out our website at the Eye Clinic of Florida, which is www.seebetterflorida.com, or call our office at 813-779-3338. Again, I'm Dr. Mahootchi, and I thank you for your attention.